Hi there. We'd like to talk to you about Psychiatric Advance Directives, a new and vital tool for first responders and healthcare providers. A Psychiatric Advance Directive is a document that contains information about a person's preferred treatment in the event of a mental health crisis. It allows their voice to be heard in medical and other treatment situations and makes their wishes known.
A Psychiatric Advance Directive allows me to know critical information about the person I'm trying to help. That can only lead to better outcomes.
For first responders, a Psychiatric Advance Directive gives the information you need to have the best chance at low-key, safe interactions with people who are in distress and who may be presenting in a worrying manner to you and others around them.
Having timely access to information about you and your preferences help us better understand how to achieve better outcomes for you and everyone involved in a time of crisis.
I think a Psychiatric Advance Directive can tell people, I do know what's going on. This is normal. You know what to do when you have the flu. You know what to do when you sprain your ankle. I know what to do when I'm having a crisis moment.
But it's also recognizing that I have insight into myself that a clinician, a doctor, a staff will not always or rarely do have.
Because this is my life, and this is just another thing for me.
If we had an advance directive prior to all of this, prior to the crisis, then we'd be able to follow what they need because they know what they need and they know what works for them.
The information in the Psychiatric Advance Directive gives you guidance in how to attain the most beneficial outcomes in your interactions and for any treatment, including such simple but important things as how to help them reach a calm state and what medications they may be taking or may need, plus important contact information. In short, a Psychiatric Advance Directive allows a person's healthiest self to speak to you and guide an interaction with their less well self, allowing you to offer them assistance and treatment in the most beneficial way for you and them. When a mental health peer is creating their Psychiatric Advance Directive, they can select and decide how each question should be answered, and these answers will be compiled into an easy-to-read profile specific to them.
The interface is very easy. It's compatible with all your phones.
Changing preferences will be easy to do. Because the Psychiatric Advance Directive exists electronically, updates take effect immediately, and anyone who has access to their Psychiatric Advance Directive will have the latest version. A person's Psychiatric Advance Directive is a private document which will only be shared with you under specific circumstances.
I would say having a Psychiatric Advance Directive, it makes me feel empowered and like if a crisis comes up for me, I'm prepared.
Don't make a decision about my treatment, my mental health, my wellness without me, because we know that we know ourselves best. Nothing about us without us. Nothing about me without me.
For more information about Psychiatric Advance Directives, visit our website, www.padsca.org.